Conduct disorder represents one of the most challenging and complex behavioral conditions affecting children and adolescents in contemporary society. This serious mental health condition is characterized by a persistent pattern of behavior that violates the basic rights of others and age-appropriate societal norms or rules. The diagnosis of conduct disorder requires careful evaluation and understanding of the multifaceted nature of this condition, which extends far beyond simple disobedience or typical teenage rebellion. The manifestations of conduct disorder are diverse and often deeply concerning to parents, educators, and mental health professionals. Children and adolescents with this condition frequently engage in aggressive behavior toward people and animals, showing a callous disregard for the welfare of others. They may initiate physical fights, use weapons that could cause serious harm, display physical cruelty to people or animals, or force others into sexual activity. These aggressive behaviors are not isolated incidents, but form part of a consistent pattern that significantly impairs their ability to function in social, academic, and family environments. Beyond physical aggression, conduct disorder often involves destruction of property, deceitfulness, theft, and serious violations of rules. Young people with this condition may deliberately engage in fire setting with the intention of causing serious damage, destroy others' property through vandalism, break into homes or cars, lie frequently to obtain goods or favors, steal items of non-trivial value, or consistently violate curfews and school attendance requirements. These behaviors typically begin before age 13 in childhood-onset conduct disorder, though they can also emerge during adolescence in what is classified as adolescent-onset conduct disorder. The underlying causes of conduct disorder are multifactorial and complex, involving an intricate interplay of genetic, environmental, psychological, and social factors. Research indicates that genetic predisposition plays a significant role, with studies showing higher rates of conduct disorder among children whose biological parents have antisocial personality disorder, substance use disorders, or mood disorders. However, genetics alone do not determine the development of conduct disorder, as environmental factors are equally crucial in shaping behavioral outcomes. Environmental influences contributing to conduct disorder include family dysfunction, inconsistent or harsh parenting practices, childhood abuse or neglect, early separation from parents, and exposure to violence or trauma. Children who experience chronic stress, poverty, or instability in their home environment are at increased risk for developing conduct disorder. Additionally, peer influences, particularly association with delinquent peer groups, can reinforce antisocial behaviors and contribute to the persistence of conduct disorder symptoms. Neurobiological factors also play a crucial role in the development and maintenance of conduct disorder. Brain imaging studies have revealed differences in brain structure and function among individuals with conduct disorder, particularly in areas responsible for impulse control, emotional regulation, and moral reasoning. These neurobiological differences may contribute to the difficulty these individuals experience in understanding social cues, empathizing with others, and controlling their impulses. The diagnostic process for conduct disorder requires comprehensive assessment by qualified mental health professionals who must carefully evaluate the frequency, intensity, and duration of problematic behaviors. The Diagnostic and Statistical Manual of Mental Disorders outlines specific criteria that must be met for a diagnosis of conduct disorder, including the presence of at least 3 characteristic behaviors within the past 12 months, with at least 1 behavior present within the past 6 months. The assessment process typically involves interviews with a child or adolescent, parents, teachers, and other relevant individuals, as well as standardized rating scales and behavioral observations. Early identification and intervention are crucial for improving outcomes for children and adolescents with conduct disorder. Without appropriate treatment, conduct disorder can lead to serious long-term consequences, including academic failure, legal problems, substance abuse, and the development of antisocial personality disorder in adulthood. However, with proper intervention, many young people with conduct disorder can learn to manage their behaviors and develop healthier coping strategies. Treatment approaches for conduct disorder typically involve multimodal interventions that address the various factors contributing to the condition. Parent management training is often a cornerstone of treatment, helping parents develop consistent, effective disciplinary strategies while improving communication and relationship quality with their child. Cognitive behavioral therapy helps children and adolescents develop better problem-solving skills, anger management techniques, and social skills while addressing distorted thinking patterns that contribute to antisocial behavior. Family therapy addresses dysfunctional family dynamics and communication patterns that may be contributing to or maintaining conduct disorder symptoms. School-based interventions focus on creating structured, supportive learning environments that can help children with conduct disorder succeed academically while learning appropriate social behaviors. In some cases, residential treatment or therapeutic foster care may be necessary for children whose behaviors pose significant safety risks or who have not responded to outpatient interventions. Medication may also play a role in treatment, particularly when conduct disorder co-occurs with other mental health conditions such as attention deficit/hyperactivity disorder, depression, or anxiety disorders. While there is no specific medication for conduct disorder itself, treating co-occurring conditions can sometimes help reduce the severity of conduct disorder symptoms and improve treatment outcomes. Prevention efforts for conduct disorder focus on addressing risk factors and strengthening protective factors in children's lives. Early childhood programs that support positive parenting practices, school-based programs that teach social and emotional skills, and community initiatives that address poverty and social inequality can all contribute to preventing the development of conduct disorder. Additionally, early intervention programs for at-risk children and families can help identify problems before they become severe and provide support to families struggling with behavioral challenges. The prognosis for conduct disorder varies significantly depending on factors such as the age of onset, severity of symptoms, presence of co-occurring conditions, family support, and access to appropriate treatment. Children with childhood-onset conduct disorder generally have a more serious prognosis than those with adolescent-onset conduct disorder, as early onset is associated with more severe symptoms and greater risk for developing antisocial personality disorder in adulthood. However, with comprehensive, evidence-based treatment and strong family and community support, many children and adolescents with conduct disorder can achieve significant improvements in their behavior and overall functioning. Understanding conduct disorder requires recognition of its complexity and the need for compassionate, evidence-based approaches to treatment and support. While the behaviors associated with conduct disorder can be frightening and disruptive, it is important to remember that these are symptoms of a serious mental health condition that requires professional intervention. With appropriate treatment, support, and understanding, children and adolescents with conduct disorder can learn to manage their behaviors and develop the skills necessary for successful functioning in society. The key lies in early identification, comprehensive assessment, and implementation of evidence-based interventions that address the multiple factors contributing to this challenging condition.